Chair and members of the committee, thank you for the opportunity to appear today. My name is Ayla Azad. I have been a chiropractor for 30 years, and I am the CEO of the Canadian Chiropractic Association. Today, I am speaking on behalf of the CCA, which represents more than 9,000 doctors of chiropractic across Canada, and more importantly, on behalf of the millions of Canadians living with pain, limited mobility, and physical disability who rely on access to musculoskeletal care to live and work. Each year, 4.7 million Canadians seek care from chiropractors. These are seniors trying to stay independent, parents working physically demanding jobs, or people managing chronic pain or injury who simply want to keep moving, stay employed, and participate in their communities. Chiropractors are primary contact healthcare providers trained to diagnose and manage musculoskeletal conditions using evidence-based, non-invasive, drug-free care. For many patients, access to chiropractic care is the difference between functioning and not functioning. Today, we are here to discuss Clause 573 of Bill C-15 and the unintended consequences these provisions could have on patient access, particularly in rural, northern, and underserved communities. Canada faces a significant training bottleneck for chiropractic. There are only 2 chiropractic education programs in the entire country, one in English at the Canadian Memorial Chiropractic College in Toronto, and one in French at the Université du Québec à Trois-Rivières. 2 programs cannot meet the workforce needs of a nation this size. As a result, approximately 30% of Canadian chiropractors are educated in the United States or internationally at fully accredited institutions. This is not a loophole. It is a necessity to meet Canada's healthcare needs. As currently drafted, Bill C-15 risks cutting off access to federal student financial assistance for students who must study outside Canada at private or for-profit institutions, even when they return home to practice and serve Canadian patients. Chiropractors are also excluded from the Canada Student Loan Forgiveness Program despite providing essential care in high-need communities. If these barriers remain, patients will pay the price. Canada is already facing a serious health human resource crisis, with many Canadians unable to access care and experiencing long wait times and delays to receive timely treatment. From a fiscal perspective, maintaining access to student financial assistance and loan forgiveness for chiropractors is a low-cost policy choice that helps prevent higher downstream spending on emergency care, disability supports, and long-term income replacement. In rural and remote communities, chiropractors are often the only accessible providers for pain and mobility care. When student debt makes it financially impossible to practice in these regions, care is delayed or disappears altogether. Pain worsens, disability increases, people leave the workforce. In many cases, medications such as opioids become the default, not by choice, but by lack of access to hands-on, non-pharmacological care. Student loan forgiveness and continued access to the Canada Student Financial Assistance Program can be the difference between a chiropractor staying in a community or never coming back at all. And for patients, it can be the difference between independence and disability. This is not about supporting one profession. It is about supporting patients. It is about ensuring Canadians, no matter where they live, can access timely, non-invasive care that keeps them mobile, working, and connected to their communities. The Canadian Chiropractic Association is asking for a practical and targeted solution. Ensure chiropractic students retain access to federal student financial assistance, and that graduates are eligible for student loan forgiveness when they practice in Canada, regardless of where they are trained, provided their education is, of course, accredited. This is a workforce issue, it is an access issue, and above all, it is a patient issue. Thank you for your time, and I welcome your questions.
Thank you, Dr. Azad.
I think I'm going to start out with you, Dr. Azad. I actually was very fortunate when I first started into my political space. I actually worked for Dr. Colin Carey, who is a chiropractor. And so I got to learn a lot of some of those unique challenges that exist in that space. And I remember calling him when I was pregnant because I was getting a lot of pain. And I said, well, I don't want to take drugs, so what are the options? And he recommended that I look into Webster technique and find someone that specialized in the Webster method for chiropractic, and it made all the difference. It went from me having a hard time sitting for long periods of time to being able to complete my normal space with no pain and just 1 or 2 appointments a week. And I think that it just goes to show that there are things that can be done, and it's effectively just simple types of stretching. So this is an important piece. How many students do the 2 Canadian institutions put out every year in terms of graduates?
Yeah, thank you, and I'm so glad that you got benefit from the care. CMCC, approximately 200 students in each class, so 200 graduate, and UQTR between 40 and 50.
Okay, and so then we're not talking about tons. How many are retiring every year?
Yes, that's a great question. We do see, actually I just looked at my membership metrics report, and we are seeing higher rates of chiropractors retiring compared to how many are coming in.
So we're having more people retire,
Yeah.
fewer people getting trained in Canada to replace just the ones that we currently have. And are there disparities in accessing chiropractic services right now?
Yes, there are. So we're actually looking into this and looking at where the majority of our chiropractors are located. We're working with Ontario Tech University to try and map this out, and we are seeing, we have decreased chiropractors in rural and remote communities, and sometimes those are the communities that require the most care. We see a higher incidence of musculoskeletal conditions in those communities, especially Indigenous communities.
No, and I appreciate that. So the change in the BIA is extremely troubling. May I ask, how many of your friends studied abroad because they couldn't get into a Canadian institution?
I myself studied abroad. I'm a graduate from Palmer College in the U.S. Approximately 30%, a little over 30% of our members are trained overseas, primarily in the United States, where the majority of the chiropractic programs are, and there are some international. And for example, in Bournemouth, England, there's a very well-respected program. Some in New Zealand, Australia.
So 30% of your current membership has studied
abroad,
outside of Canada.
Yes.
Of those, could you give perhaps a bit of a guess as to how many of those were Canadians that were forced to go abroad to study?
Yeah, I mean, so these are members of the Canadian Chiropractic Association. So 30% of them left, studied, and came back, and now are our members. So yeah, I mean, it's impossible for CMCC and UQTR to meet the needs. They can increase enrollment, sure, but it's only 2 programs. It's just impossible for an entire nation to be serviced with 2 institutions.
Ms. Azad, we're meeting again. I remember having met you to talk about specific issues concerning your own professions. So I wanted to say that this is a service that we use. It's care that we use regularly in my family for all kinds of problems of health. We know that chiropractic is excellent in terms of prevention and in order to take care of various health problems. So I'll start with you because you opened the door when you replied to one of the questions from my Conservative colleagues. You said that 30% are trained in the U.S., New Zealand, and Australia. I'd like to go a bit further. Why are the students going specifically to those places, and what are the good practices that we can use in our recommendations related to this?
So thank you very much for the question. It's nice to see you again. I would say, again, there are only 2 programs here in Canada, so there are limited number of seats for these students. They have to go overseas. As I said, I myself have gone overseas to get my degree, but I'm now fully immersed here in the chiropractic community in Canada, it's. from a financial perspective, it's very costly to get a chiropractic degree. So these assistance programs are essential for our students to be able to, one, get the degree, but then also start practices in communities and be able to, live and pay back all of this financial assistance. It sometimes can be the difference between someone being able to access the chiropractic program or not. And if we don't have enough chiropractors to service the needs, that the burden of musculoskeletal conditions in this country is huge, and it's costing the economy billions of dollars. So we need more professionals that can manage the disability that's coming. We have an aging population. We need more rehabilitation specialists and experts, and chiropractors can certainly help fill that need.
Donc, si je comprends bien, en fait...
So, if I understand, well, I'm asking a question, maybe you can answer in 30 seconds. What or how could the federal government support training, which is a problem for you? You talked about two problems, only one at University of Trois-Rivières, while respecting the jurisdiction which Quebec have in terms of education, among other things.
I think, firstly, making sure the financial assistance remains, but also the student loan forgiveness program. We were excluded as a profession from the student loan forgiveness program, and I think that's a challenge for us. We want to encourage more students to go into rural and remote communities, and as I said, there is a need. So I think bookending this financial assistance in the beginning so that they can get the training that's required, and then student loan forgiveness so they can come back and service communities here in Canada.
Ms. Azad, then I would like to end my turn, maybe in 30 seconds. What are the specific problems in terms of access to the care, the chiropractic care in remote areas, if you can summarize what the challenges are?
There are a few challenges. One, access. We are, in order to access our care, many patients have to pay. It's private, so cost certainly is a barrier. That's why we're advocating to get chiropractors included into the non-insured health benefits program, so Indigenous communities can access our care. In rural communities, sometimes there's just not enough. There's not enough chiropractors available for patients to see. They're having to travel great distances to receive very important, timely care. So I would say those are the largest barriers. Thank you for the question.
So you said that there's a shortage of schools, about challenges in remote areas. What is the impact for succession in terms of access to chiropractic care in remote areas? What measures can be taken to improve the situation for the future?
Absolutely. I would say, one, allowing students to be able to go overseas to get the training and come back. As I said, 30% of our members do that and are here. Then improving access. I really feel in the healthcare system we need more team-based care, integrated care.
A couple questions for you, Dr. Azad. You said two programs here in Canada. And you talked about the reliance on training outside of the country. What you didn't speak to is, from my understanding, the institutions that are in Canada are also private institutions. Now, they're private, not-for-profit, if I'm correct, so they would not be impacted by the budget policy. But that underlines for me that these programs are not being offered at public institutions, which means that we might hope that there would be an expansion in the availability of these programs in Canada, but likely that expansion would not be on the public institution side, it would be on the private side. So if a private for-profit institution saw the demand, saw the opportunity, and wanted to get into this, they would be affected by the policy. So with an eye to how we can maybe grow the availability of this training here in Canada, how would the budget policy which proposes to cut off grants for students studying in Canada at private for-profit institutions, how would that affect trying to address the gaps in training?
Yeah, thank you for the question. To become a chiropractor, it's a significant financial burden. And so if you're not able to get financial assistance through these national student loans, it just becomes very cost prohibitive, even for a student here in Canada to be able to attend, CMCC, for example, in Toronto. Our students are graduating with approximately $150,000 to $200,000 in debt, and that's significant. It's difficult. So I would say it would be detrimental for the programs here as well. As far as not being in the public system, I'd love to be able to see a chiropractic program in some of the public universities. Just like to be on record for that. That I think would be an excellent way to help with this resource problem that we're having. Because, and again, I will say, the next issue that this country is going to face is disability and the need. We have an unmet need for rehabilitation services in this country, and we need to work together to solve that.
Yeah, thank you. And just so I have the time left, what we've put forward as Conservatives as part of our youth jobs plan is that grants be linked to labour market demand, that there's an opportunity that grant value could magnify those market signals to students so that they have that information. Also, hey, you can study whatever you want, but if you're getting a grant, maybe that should be tied to the needs of the labour market. What are your thoughts on, instead of discriminating based on institutions, linking back to where the demand is?
Well, it would be good for chiropractic because the demand is huge. As I said, when you look at the issues that we're facing in this country when it comes to musculoskeletal conditions, we do not have enough providers. And I would even say, my colleagues in physiotherapy as well. We work together all the time. I think we need more chiropractors. We need more rehabilitation experts.
And Dr. Azad, a summer student that worked for me the last 3 years, this is his final year of the Toronto Chiropractic. He will be a doctor shortly, and I'm sure he will serve Canadians well. So thank you for coming in.